The American Health Care Act of 2017, known by its acronym the AHCA, was introduced in the United States House of Representatives at the end of March 2017 by its sponsor, Representative Diane Black of Tennessee, and it passed the House on May 4, 2017. The AHCA amends portions of the Patient Protection and Affordable Care Act, widely known as the ACA, or Obamacare, and it is endorsed by President Donald Trump and Speaker of the U.S. House of Representatives Paul Ryan. As presented, the AHCA is a budget reconciliation bill, meaning that it will not be subject to filibuster in the Senate due to debate limit of 20 hours. The bill is the first phase of a three-phase process with the goal of repealing and replacing the Affordable Care Act. Phases 2 and 3 will include administrative actions and additional legislative policies and bills as outlined by the Department of Health and Human Services. In its current form, the AHCA is poised to bring major challenges and overhauls to the Affordable Care Act. The AHCA differs in several ways from the ACA, or the Affordable Care Act. The first significant change under the AHCA is the removal of the requirement that every person or employer be required to purchase or provide health insurance or face a penalty payment. Although there is no insurance mandate, the AHCA will impose a quote-unquote late penalty for individuals that do not purchase insurance and then experience a lapse in coverage of greater than 63 days, and then decide to purchase at a later date. The continuous coverage penalty comes in the form of a 30% surcharge that individuals will be required to pay for 1 year in addition to their premiums. When it comes to health savings accounts, the AHCA increases the tax-free contribution limits to $6,550 for individuals or $13,100 for families, while allowing for spouses in married couples to make catch-up contributions to the same health savings account. A second change, and one of the more controversial changes that the AHCA brings to the Affordable Care Act, is a 1-year restriction that it imposes on federal funding to certain organizations that provide abortions. The rule applies to entities that meet all of the following criteria. 1, it's a 501c3 tax-exempt charitable organization. 2, it primarily provides family planning services for reproductive health. C, or 3, it provides for abortions, not including abortions in cases of rape or incest or where the woman's life is in danger. And 4, previously received more than $350 million under Medicaid in 2014. Organizations that meet these criteria will not receive funding under the AHCA. The AHCA summary, provided by the Library of Congress's Congressional Research Service, specifically lists Planned Parenthood Federation of America as an example of one such organization that will not receive funding under the new bill. Thus, Planned Parenthood and similar organizations are specifically targeted by the bill to cut off their funding. A third change to the Affordable Care Act under the new bill is that states will be allowed to opt out of certain consumer protections that were written into the Affordable Care Act. Pre-existing conditions are included as one of these specific situations. And under the new bill, states will be allowed to opt out of mandatory coverage. However, pre-existing condition coverage will remain protected for individuals that maintain continuous coverage. Another example is that the ACA specifically set aside 10 services that every health plan is required to cover. Among the services included are mental health and substance use disorders, prescription drugs, pregnancy, maternity, and newborn care. Under the new bill, individual states would be in charge of establishing their own standards for exempting insurers from providing these essential health benefits by applying for a waiver. When it comes to the ability to charge higher premiums based on age, the Affordable Care Act imposes a limit that prevents older individuals from being charged more than 3 times as much as younger individuals. Under the new bill, however, this limit is being increased to up to 5 times the amount younger individuals are being charged, and it may be preempted by application for a waiver on an individual state-by-state basis. One of the more interesting changes that the new bill brings about is the complete removal of a 10% excise tax that was placed on the price of indoor tanning services. In support of removal of the tax, Representative Jason Smith of Missouri took the time during a recent session on the House floor to point out that the tax predominantly served as a tax on women, after conducting a quick Google search that showed that roughly 80% of individuals that used tanning services were women. Other changes include that the Affordable Care Act provided opportunities for individuals to take advantage of tax credits for out-of-pocket expenses. Additionally, the Affordable Care Act placed annual limits on costs associated with healthcare delivery, such as coinsurance, copays, and related costs. Under the new bill, individuals may utilize a tax credit based on their age rather than the Affordable Care Act's previous tax incentive program that was based on income, provided that the taxpayer makes less than $75,000. Under the new bill, taxpayers under the age of 30 may qualify for a credit of up to $2,000, while individuals over age 60 may qualify for a credit of up to $4,000. For taxpayers that make over $75,000 in a year, the tax credit they're eligible for, based on their age, will be reduced by 10% of any income generated over $75,000. After 2020, the tax credits and annual income threshold will be adjusted for inflation based on a formula set forth in the new bill. Additionally, the quote-unquote Cadillac tax imposed on employer plans with a higher, more expensive cost will be pushed back from an original effective date of January 1st, 2020 under the Affordable Care Act to January 1st, 2026 under the new bill. The new bill includes multiple sections providing an enhancement to the Affordable Care Act Medicaid programs. Starting in 2020, the new bill limits federal funds granted to states for Medicaid programs, specifically the federal medical assistance percentages, unless the enrollees were enrolled prior to 2020 and do not subsequently have a break in eligibility lasting longer than 1 month. The limitations are capped based on a formula that examines an individual state's 2016 medical assistance expenditures in a variety of enrollee categories, with a reduction in federal funding the following fiscal year in the event that a spending cap is exceeded by the state. Additionally, the bill removes the options for states to extend Medicaid coverage to non-elderly adults if those people have incomes above 133% of the poverty line. It also lowers the minimum family income threshold for families with children between ages 6 and 19 that allows states to determine who's eligible for Medicaid. It reduces those limits from 133% of the poverty line to 100%, meaning that states will be allowed to exclude more people than they were under the Affordable Care Act. The bill also removes, starting in 2020, the requirement that the states provide an alternative benefit plan that covers essential health benefits. Finally, the updated Medicaid provisions under the new bill allow a state to impose work requirements on recipients as a condition of eligibility, with some restrictions for some people, including pregnant women. Some aspects of the ACA, on the other hand, are remaining in full effect without much change or even without any change at all. Young adults, for example, will continue to be allowed to take advantage of a parent's health insurance plan until they reach age 26. In addition, the new bill apparently will continue to prevent insurers from setting a lifetime limit on how much they will pay to cover an individual over the course of his or her lifetime. For example, before the Affordable Care Act was passed in the first place, an insurance company could institute, for example, a $1 million maximum coverage limitation for the whole lifetime of an individual. Under the Affordable Care Act, and what will remain in effect under the AHCA, these lifetime limitations will not be allowed. Now that the AHCA has been passed by the House, it will go to the United States Senate. The United States Senate can pass the bill in the exact same form, and if it does, it will go to the President for signing, and then become law. However, the Senate may not pass the bill, or the Senate can make changes to the bill, in which case the House would then have to vote on the Senate's version. Committees from the House and Senate could then get together and work out a vision for a bill that would be palatable to both houses. There are already talks of a major overhaul and sweeping changes that will take place before the bill will be approved by the Senate. After all, the bill only passed the House by a small margin, with a final tally of 217 in favor to 213 against. The Senate has not yet set a timeline for obtaining a vote, but as Senator Lamar Alexander from Tennessee alluded to, it does stand to change significantly. We will continue to watch to see what the Senate will do with regard to this bill and if they will pass any version of it, and if so, whether that same version can pass the House, the Senate, and eventually be signed by the President and become law.